We're at over 54%. Here we're in the 40s, and so we want to be able to increase that. This will help us, I think, make some ground there. But that's not it. That's not all. The other thing we're doing is through our partnership with Walgreens, they've agreed to offer vaccines at 2 of their pharmacies in Citrus County. So one is located at 310 Northeast US Highway 19 in Crystal River. The other is located at 104 South Apopka Avenue in Inverness. And beginning today, you can visit walgreens.com and click COVID vaccine information to schedule an appointment. The first appointments will be made available starting tomorrow. To start, 80 appointments will be available on weekdays at each store, and 60 appointments will be available on Saturdays and Sundays. And so this is yet another way to have vaccine in people's communities. A lot of these places like Walgreens and CVS and Publix, people trust, and they'll be able to do it. So we are going to do even more Walgreens in the coming weeks, and I think that that'll be particularly important when we get to a point where we can lower the age to below 65, which is going to happen relatively soon, certainly this month. And it's just a matter of looking at how much vaccine we're getting and how much coverage we're getting for seniors. But also here in Citrus County, we have 4 Publix pharmacies. So Citrus is one of the original pilot counties for Publix. So we did Citrus, Hernando, and Marion. They set up the appointments. They did it. I actually came down to Hernando and visited a number of the stores after the first couple days, talked with the seniors. They've liked it. It's done very well. So we've kept that going. We also have 3 Walmarts in the county and 2 Winn-Dixies. So that's running a pretty good gamut: Walgreens, Publix, Walmart, and Winn-Dixie. Publix signups will open up again tomorrow morning at 7 a.m. and it's publix.com/COVID vaccine. Walmart is walmart.com/COVID vaccine. And Winn-Dixie is winndixie.com/pharmacy/COVID vaccine. So we've done millions of seniors to date. We're over 54% of all Florida seniors have gotten at least 1 shot. As I mentioned, Citrus is in the low 40s, so they're far below the state average. We've got some counties, St. John's, for example, they have 80% of the seniors have gotten at least 1 shot. Even some of the large counties like Palm Beach is 63, 64%. Broward and Duval are over 60%. Miami-Dade is now basically getting to the state average, and they're going to blow past that because we did a lot of the CVS for there. So there we go. Tighten that up a little more next time. So we like what's going on a lot, but I think what we've done and what Andy's been instrumental in, because he's been working this whole region, is Citrus. We were in Hernando in one of the mobile home parks last week, very successful. We were in Pasco yesterday with Wilton Simpson, be able to do Pasco. I was in Pinellas a couple weeks ago at Mainland's senior community in Pinellas Park. We also have done Sun City Center and Kings Point in Hillsborough County. We did Manatee, we did Lakewood Ranch, we did a couple in southern Sarasota County, and then we've also done stuff in Charlotte. So you've seen Sarasota's bounced up nice, Pinellas has bounced up nice, and I think Citrus is going to do the same thing. Still got a little more work to do probably in Charlotte to get the numbers up to where we want to go. But I think this will make a big difference here. We also are going to continue with our sites. I was at Edward Waters College last week in Jacksonville. We have Edward Waters. We have had the Pahokee site going on for a while. We have FAMU in Leon, Kissimmee Community Center, Broward College, Oak Grove Park, and Overton Youth Center, both in Miami-Dade. So those are really trying to make sure we're getting into as many communities as possible. Of course, we've done a lot of events with faith-based communities. We've done dozens and dozens of faith communities throughout the state of Florida. We're going to be doing a lot more this weekend, which we're excited about. Here in Citrus County, the health department is offering 2,800 Moderna vaccines at the health department. So if you need one and you don't want to come to this one, that's another option for you to be able to do. We've now done over 25 different senior communities like Mainlands and Pinellas Park and like some of these others. We're going to continue to do that. We think that that's very effective. We've also done over 1,400 seniors in our Homebound Seniors program. So there's some folks that may not be able to get around as easy. We're sending teams into the comfort of their home, done a lot of World War II veterans and a lot of Korean War veterans. Yesterday, the federal government and we were collaborating, but FEMA set up 4 sites throughout Florida: Miami, Tampa, Orlando, and Jacksonville. Demand was relatively tepid. I think that they had the capacity to do about 12,000 shots. I think they did about 6,500. And so, that's just the first day. We'll see how that goes as we go forward. But obviously, that's additional vaccine to what we're already getting. So we're very much appreciative of having more vaccine here. And then we also anticipate getting sometime this week the first shipment of the Johnson & Johnson vaccine. So that's 175,000 doses. We're not going to get any J&J next week. So really the 175,000 J&J is going to last us for the 2 weeks. I mean, we may use it before then, but this is the only J&J for the next 2 weeks. We're going to be working with our law enforcement, fire, and also education to be able to offer J&J for the 50 and up communities in those. I think it's a very effective way to go in, vaccinate a lot of people. You can even go on site to some of these places. You do 1 shot and then you don't have to worry about it. These sites are great with the Pfizer, but every time we go into a senior community or a church or something like that, you got to set it up to come back in 21 days or 28 days with Moderna. With the J&J, you can take it everywhere. You do it and you never got to go back to that place. You can just keep going and doing everyone's 1 dose. So we think that has an opportunity to really do well, particularly for people who are under 65, particularly for people who are still in the workforce. So stay tuned on that, and we are going to be able to do some announcements very soon involving the Johnson & Johnson vaccine. But I'm happy to be here in Crystal River. This is something that we work with Wilton Simpson on to make sure that we are increasing senior coverage rates. Again, we're in the low 40s of percentage of seniors in this county that have been vaccinated. I've got a lot of counties that are in the 60s and 70s throughout Florida. So we want to get Citrus to be in that same range. And once that happens, I think it's going to be very, very good. I mean, we have seen the hospital census statewide has gone down dramatically over the last 6 weeks. That's a great thing. But obviously, the more seniors you're able to get vaccinated, I think the easier it's going to be to make sure that those hospitals don't see a lot of patients coming through for COVID in the months ahead. And with that, happy to take some questions. So the federal government put that order in, and so that they've made the teachers, regardless of age, eligible. So they are eligible to get vaccinated per that order. Our view is if you're 25, you're just at less risk than somebody that's 80. That's just the bottom line. 95.7% of all COVID-related mortality has been above the age of 50. And so the age-based approach we think is the most effective to reduce mortality. At the same time, federal government's the one sending us the vaccine. If they want it to be for all ages, then they have the ability to go and do that. And so the pharmacies are obviously going to accommodate that. These sites will accommodate that. But our number one goal right now is to get through the senior population. I don't know how many seniors ultimately are going to want it. It's not going to be 100%. But if I'm seeing 80% in St. John's already, I got to think that we're going to be able to get to 65, 70, 75% here in Citrus as well. So we definitely want to do that.
Governor, what do you think the realistic rate for the percentages of Florida as a whole to get vaccinated?
So the question is what's the realistic rate for Florida as a whole? A couple things. One, I think anytime someone shows you a statistic, this percentage of the country has gotten a shot, understand 16 and under aren't eligible for shots, and 18 and under aren't. I think Pfizer's 18, Moderna's 16, or one or the other. So basically, people that are under 18 are not even eligible. Well, that's tens of millions of people throughout our country. That's obviously millions of people here in Florida. So you got to take them out because they're not eligible under the EUA. Now, maybe they will be approved for them in the future, but it's not now, so you're not going to do that. So then you're looking at the 18 and up population, basically. And in my view, I think what we'll see, the uptake is going to be highest amongst elderly, and the lower you go on the age stratum, the fewer you're going to have in terms of uptake from there. So I think there's going to be a much less percentage of 25-year-olds that want it than 75-year-olds. And that, I mean, honestly, that's sensible because the risk is much different in those. So I don't think you're going to get above 50% of people that are under 50. And I think you may even be less than that. But I think the messaging is important. When you have these people saying, oh yeah, you get vaccinated, you still can't do anything, you got a social well, why would someone want to do it at that point if they're not serious risks? So I think the message needs to be, you know, the more people that get vaccinated, you know, we're going to be able to do whatever you want to do. Now, Florida, we obviously are open, we trust people, and I think that's been a better approach, but still, we should want people. There should be an incentive for people to want to get vaccinated. But I don't think you're going to see below 50% for under 50. I'm pretty sure in terms of the ones who want it. And in Florida, we will not do any vaccine mandates. This is your choice. We're going to bring it to everyone who wants it. If you want it, great. If you don't, that's your decision.
Governor, what's your response about more calls for an investigation this morning after the Miami Herald article?
Well, one, the Miami Herald article was a train wreck. That was not a site that we were involved in the Keys. What that was one of the South Florida hospital systems went to this community, vaccinated a bunch of seniors. I think that's great. I want seniors to get shots. I think they did a good job doing that. We just weren't involved with it in any way, shape, or form. And the initial 3 or 4 weeks, as you remember, the hospitals were getting the lion's share of the vaccine. We had nursing homes, we had hospitals. Some of the county health departments started to get them at the end of December, but you really didn't see the big push even in the counties until January. So that was something that one of the systems they went on site, they did 1,000, 2,000, however many seniors. And my view is if you're 65 and up, I'm not worried about your income bracket, I'm worried about your age bracket, because it's the age, not the income, that shows the risk. And so if they were able to go in a community that is heavily senior and vaccinate people, that's very, very good. But for that article to suggest that somehow that was one of our sites, that's just factually wrong. I think it was good that they did it. I support the hospitals doing that and really being proactive and trying to reach as many seniors as possible. But it was a really, really poorly executed hit piece. And what they're trying to do, they're trying to manufacture a narrative, but they don't have the facts to back it up, and that's a perfect example of that. So it was a major failure, and you know, we're happy that the hospitals were doing that, but again, that wasn't one of our sites.
So just for clarification, you're saying Bruce Browner's contribution has nothing to do with vaccinations that happened in Florida?
We had nothing to do. The state was not involved with that, and I don't know. Do you know? Has he even been vaccinated? Do you know? Okay, so I mean, literally, they're just trying to indulge in conspiracy theories. But that was not a state site. It was not anything that the state set up. It was done through one of the hospital systems that had vaccine. They thought it made sense to go and do 65 and plus, and I think it was a smart decision to do that. And they've done other things, I'm sure, in other parts of the community as well, but wasn't a state site, and so that article was just flat wrong.
Governor, do you anticipate another site such as this, perhaps on the eastern side of Citrus County, to boost the senior numbers?
I think if there's a need for that, and we can be helpful, you know, we would want to be supportive of that. So we'll get through this, and then if there's a proposal and you have some folks here in the county that want us to help, you know, we're happy to do it. I mean, we've basically been focusing most of these additional vaccines as they become available on the counties that are below the state average. And we've been able to get some of them above the state average, which has been really exciting. So we want to continue to do that. These 3,300 will help, but we do need to do more. So I'm totally open to be able to do that.
Can you talk about the inter-county work ability with each other? With Andy's from my county, here he is. I've seen him cover him in a couple of counties. Can you talk about the cooperation among the counties?
Oh yeah, well, I mean, Andy's really spearheading this. You know, when we're doing this stuff, we're looking at the data on a daily basis, and as more vaccine becomes available, you know, we'll say, okay, you know, they're not doing their 39 Citrus now 41, but it was like, okay, they're lower there, and within 24 to 48 hours they can get a site up, and they've done it all across here. So it's pretty incredible the work that they've done. And we were in Pasco yesterday. They did a great site. All the seniors were very happy. But they also did one at a mobile home park in Polk County as well. Same thing. You know, again, these are counties that are below the state average for senior coverage. And so to see the number of sites that they have been able to do and really make an impact on these seniors, I think it's really, really good. And I think our logistics in Florida has been as good as anywhere in the state. And I think a lot of it is because of folks like Andy, who've really just don't sleep. They want to get these things in, and their mission is to get as many shots in the arms of seniors as you can. So I'm proud of what they're doing, and I'm proud to be here. But maybe we'll be back for the other part of the county very soon. So thanks, everybody.